just as an FYI. So for those that have joined, I want to thank you. My name is Kyle Tweed. I'm the Communications and Outreach Coordinator for the Department of Labor. We'll get to the VOSHA folks in just a minute, but just want to do some quick housekeeping, as I was saying. So you're with us today for the Leadership in Safety and Health discussion and presentation on leadership and safety. We're holding this event today in coordination with the National Department of Labor and federal OSHA as a part of the Safe and Sound Week campaign that they have every year. Safe and Sound is a year-round campaign to encourage every workplace to have a safety and health program, and our VOSHA team obviously works hard on promoting that effort, and we'll have Dan Whipple from our VOSHA program manager talk more about that in just a few minutes. But just wanted to just let you know, if you have questions, please feel free to throw those in the chat. Would ask you to keep your cameras and your cameras off and microphones muted for the duration of the presentation. As I mentioned, Dan will be presenting some information to provide on this important topic, and we'll look forward to taking questions and comments at the end. But also want to promote the fact that we do have some information on our labor.vermont.gov/VOSHA webpage, so you can go there to get more resources about the Safe and Sound campaign. So Dan, I'm not sure if I missed anything, but if you're ready to go, I'll turn it over to you, and we'll get this started. As I mentioned, this presentation will be recorded. We'll put it up on our YouTube channel, as well as potentially some shorter form resources as well. So Dan, if you're ready to go, I'll turn it over to you, since we're a little after 10 o'clock now.
Thank you. Thank you, Kyle. So yeah, this is the kickoff week of the OSHA Safe and Sound campaign, and this campaign has been going on now for, I want to say, a few years. And the thing I like about this campaign is that it really gets to the base attitudes and feelings and values that we all hold when we're going through our safety programs, our management systems, and things like that. And it's a great focus on getting back to what we do. And some of you will probably find this presentation a review. It's actually been, over the past few years, it's actually been a very popular request for me to present. And the whole impetus behind this presentation was, a number of years ago, we had an employer fatality that we investigated, and it really came down, as a lot of these types of incidences do, to some decisions, communications, things like that were made. And in this presentation, we talk a little bit about root causes and trying to figure those out. And in this particular incident, it really was sort of a situation where if a better choice had been made, if the more fertile ground for a better choice had been made, that particular person would not have died on the job. And that was, we see, a number of these, and but that one there just kind of struck a nerve, and that's the reason why I created this presentation. We will be putting a version of this presentation. This is sort of an abbreviated version, so I'm going to be including more slides to add more information to allow employers to use when they're working with their safety committees and their supervisors and their managers and folks like that, and they're working on their safety and health management systems. So you can you'll be able to go right to the website and download the the PowerPoint, and you can use it for training yourself if you like, along with all of the activities of Safe and Sound Week. So we do, and also we do have some more activities planned for later on in the summer as well. And maybe towards the end of this, I'll have Carl Hayden, our new compliance assistant specialist, talk a little bit about some of the things that we're planning on that are going to be more towards the fall. But again, I think this sort of segues into this whole week. I couldn't imagine a better kickoff week than thinking about leadership and safety as you're going through the activities with your, with your workers and, employees and safety groups and things like that, and really raising awareness of, safety and health on the job site, and that it takes leadership from everyone to be able to be successful. You don't get to check out of this. The classic, you punch the time clock and turn your brain off. That doesn't happen. And so everybody has some responsibility here. And that's, I think, what I try to really purvey when I go through this, is that everybody does have a role and everybody does have a responsibility for leadership. And when that does break down, it really leaves us in a risk for something bad happening. So that's sort of my my segue in. I thank you very much for being here. Some of you I know very well. Some might be new, and if you're relatively new, welcome. And you now that you have seen me, everyone who knows me knows that I'm very approachable. I'm on the state email system. Carl Hayden is also on the state email system. Please, if you have any questions or anything like that later on, don't be afraid to drop us an email, send a call our way, and we'll be sure to get back to you. So what is leadership, and how can we relate that to safety? And what is it, what does it mean to us? Is it ethics? Is it culture? Personal responsibility? What is each one of our definitions? And I think it's one of those situations where, depending on what, where you are, in your work life, it could mean different things, or it could mean a group of things. But hopefully that'll be a question that you'll address as you go forward this week with your employees and teams. So here's some things that I've heard in the past. Remember, I've been working for VOSHA in one capacity or another for since 1997. So. But here's some statements that I've heard in the past, and tell me if you haven't heard these. We want our employees to be safe. We preach safety. Safety is our #1 priority. We tell our employees that if they don't feel safe, they shouldn't do it. And what does that mean? I think that those are easy statements to make, and I think a lot of times we tend to make them to cover a situation that does need more improvement and more communication. So we ask ourselves, why do incidents happen? And incidents are always the result of root causes. And I know quite a few people on the line have probably some real extensive training in root cause chains of events and things like that. And root causes are understood to be those initiating causes. So if we can take a root cause and nullify it, then it is understood that that chain of events that could lead to an incident where someone gets hurt or killed would be blocked. It would be cut off. There would not be a chain of events. And root causes always come down to two factors, and quite oftentimes, and most times, and most by a vast majority of times, these factors play together, and they are unsafe acts and or unsafe conditions. And very oftentimes we find that there is a combination of both, and they play, and sometimes they just they hit that one combination of a million that sets in motion that particular incident. You know, I'm a little bit, I don't want to say, well, maybe sad is the word, but certainly aware today, as I come into work today, doing this presentation, knowing that last week we, as a program, saw a number of incidences and one fatality, and one, at least one that was a very serious injury that we're currently investigating now. And so, you know, this is, you know, to me, you know, after our Friday, you know, this is an extra motivation, you know, an extra high level of value for me to go through this with you. But again, root causes, generally we understand that if we can block those causes, if we can intervene in those causes, then we can stop that chain of events. And if we stop that chain of events, that incident will not happen. So here's, you know, we always talk about financial, and I know, you know, I always tell employers, and what I have seen in working with employers through serious incidents is financial, you know, risk is not the only risk, especially in the area if you have a fatality. I mean, there's some real feelings that go on. I always say that there are two families that are affected by serious incidences and fatalities, and they are, you know, the biological family of the worker who was involved, but also the work family, and that's not an insignificant thing. But we do talk about money, and accidents do cost money, and so this group, NCCI, which is the National Council of Compensation Insurance, has broken down the cost of incidences that cause bodily harm to two major areas: direct costs and indirect costs. Now, direct costs are generally those upfront costs that are borne by some sort of insurance, right? So they are, you know, they're medical costs for the, you know, for the employee. They might be payments to the family of a fatality victim. They're generally borne by you know, workers' comp insurance. They're the upfront costs. Those are the dollars that you see. You know, those are the ones that you see and you say, thank goodness I don't have to pay those out of my pocket. Although later on it'll come back to you, and we all know that. But those are the direct costs. And generally speaking, employers are not on the hook for direct costs. But then there are indirect costs, and indirect costs are always paid by the employer. They always come back to the employer. And sometimes, and most of the time, direct costs are actually higher than, I mean, the indirect costs are actually higher than the direct costs. And these costs include any wages to injured worker for absences not covered by workers' comp, wage costs related to work stoppage, overtime costs for people shifted around, administrative time spent by supervisors and safety personnel, training costs for replacement workers, lost productivity, all these things, cleanup, repair of damaged equipment. You know, all these things come into the indirect costs. And also something to remember is if there's a VOSHA or an OSHA inspection, depending on what state you're located in, and that inspection leads to you know, citations that have a penalty, those penalties are also indirect costs. And unless you have some sort of an insurance that covers that, those are directly out of the employer's pocket as well. And actually, there's a formula that they use to figure indirect costs as they relate to direct costs, and indirect costs almost always are more expensive in the end than the direct cost. So OSHA has this little tool that you can use, and you can just go right on the OSHA website and go right on the alphabetical listing and go right on to Safety Pays, and it'll bring you to this tool that we use. And I just thought I did this a while ago, so I thought I would just throw in a couple of slides here to kind of give you an idea of some direct costs and indirect costs and how they relate to each other. So in this particular tool, you can actually go in and select various injuries, right? So if you have a particular industry that has a an exposure to a type of an injury, you can actually go in and you can take a look at it. So in this particular model, I just selected the fracture. Common injury could be a fractured leg, could be a fractured arm. They don't really relate to which limb, but I just selected a fracture. And so what it does is it pops the average direct and indirect costs into a formula, and you can select your profit margins. I selected 3%. I think that's the default margin. And it kind of gives people an idea, and this is where it's really useful because it gives people an idea of what it costs to overcome those things. So in a simple fracture, the direct costs are $48,492 with the indirect. So that's the medical expenses, that sort of thing, emergency room and all that. Maybe some therapy afterwards. And the indirect costs. Oh, I'm sorry. Yeah, sure.
Can you advance your slides?
Oh, they're not advancing?
Maybe I'm the only one, but I only see your face slide, the start of your deck.
Is that the way it is for everyone?
No, Dan, I can see the 3% profit margin slide.
Yeah,
I see the 3%.
Okay, it's just me. I'm
Richard,
good.
come on in here and break the social distance rule.
Yeah.
So everyone else is seeing the slides advance?
Yes.
Okay. Thank God. My heart just jumped in my throat. Okay. So we're good. Richard will have to go watch another thing. So now I've just lost my screen share. Let me try this again. Okay, is everybody back on the 3% profit margin?
Yep.
Slide?
Yes.
Yes.
Okay. So now if I advance this, hopefully it'll advance. But anyways, while we're right here, you can see the direct costs and the indirect costs. And in this case here, the indirect cost is a few $1,000s more. But I think the more important thing here is this formula underneath that says, sales to cover indirect costs at a 3% profit margin is, $1.778 million. And I think sometimes, folks don't tend to realize what kind of exposure that leaves for the employer, since the indirect costs are almost always borne by the employer. Okay, so let me see. Did that slide just advance?
Yep.
Yes.
Okay, good. Okay, so we're on track. So what I did also here is you can add these injuries together. So I suppose you could add enough injuries to find out what puts you out of business. But what I did here was I added a concussion. So say a person fell, broke their arm, but also suffered a concussion. Not a terribly unrealistic, sort of event. And so when we add that together, this feature will add those together. We'll add those medical and indirect costs together. And so now we see a real dramatic rise in the, the total costs, the indirect costs, added into it. And when we go down and we look at sales to cover the indirect costs, and again, remembering the indirect costs are primarily borne by the employer, they more than double. And so, this is something I just took some screenshots of some slides that I did, but this is a game that you can go into. Well, I don't know that game's the right word here, but this is an exercise that you can go into when you're having a staff meeting. You can pop right in and go into the OSHA webpage and pull it right out, and you can do it, and you can have people select an injury, and the formulas work automatically. And it really, I think it serves to really show people the the financial implications of decision making, good decisions or bad decisions, however those go. And speaking of decisions, this is a neat little statistic. So the average adult makes 35,000 decisions daily. So it got me kind of thinking, like, so we spend a lot of time in our workplace, theoretically, maybe not quite, but theoretically, a third of our time is spent in the workplace. And so what sort of impact does the workplace, or do workplace decisions have? And then what sort of impact does workplace culture have in the decisions by us, by managers, employees, supervisors, and how does that workplace culture guide us in making decisions? Because I cannot tell you how many times I have spoken to employers after an incident, and some of these incidents are fatalities. So and when I'm speaking to people, a lot of times their emotional state is been very shaken and they're disrupted. But these people will say, I don't know what they were thinking. I cannot fathom how that happened. And our job is, as VOSHA, is to fathom how that happened and to get to the bottom of it. And just as many times when we get the report of investigation, and I show that report of investigation to the employers, it's a lot of times an eye-opening experience. It really is. So these are really important considerations to make and to consider with your employees. So this is, most of us have seen this sort of triangle. It's been around for a while. It's called Heinrichs Triangle. And the statistics listed inside of the triangle are roughly pretty stable. So 2 million unsafe acts ultimately ends up in a fatality. But of course, we know that just like Vegas, every once in a while, somebody goes to Vegas and becomes a millionaire while the rest of us unlucky souls get poor. Every once in a while, somebody draws the fatality card, and maybe that's the first time on the job. Maybe it's the 35-year employee, but every once in a while, that doesn't work out that way. And so I read an article some couple of years ago. I actually gave credit in the bottom of the slide here, and maybe you can still go on that website there that I scoped out and read this article. It was a really good article on leadership and safety. And one of the things I took out of that article was this pyramid, and the question in the article was, what if we can change this, this last slide here? What if we can change that? What if we can actually make a difference in the foundational areas of this triangle to add these pieces in, accountability, recognition of hazards, communication between employees and supervisors and managers, also holding supervisors accountable, safety in their performance evaluations, disciplinary, good, consistent disciplinary process, and good investigation to find out root causes. The article was, can these things make a difference? And they had this little graphic that they had put out there, and in fact, we know that they can. We know that they can make a big difference. And so, interesting article. If you can get to it to read it, I found it to be very interesting. So it all comes down to, how can we make better decisions? And I think it's not just, a decision between right and wrong. It's not black and white, and very rarely is it black and white. But in fact, it really starts with a foundation. And this whole Safe and Sound week is based on the foundation that we're going to talk about, and that is safety and health management systems, and how those systems function within our particular work sites, within our particular business models and culture. They may look different, but if we can effectively engage in good safety and health management systems, that can be the foundation that we can ultimately create a an atmosphere where people feel empowered to make good, healthy, and sound decisions, both for the company and for themselves and for their fellow workers. And so one of the things you'll see as you go through the activities in Safe and Sound Week is they constantly talk about safety and health management systems, and there are 4 core values of safety and health management systems. And if anybody out there is currently an OSHA VPP site or a VOSHA Green Mountain VPP site, these 4 core values very well, because that whole excellence and safety partnership is based on these 4 core values. Nothing more, nothing less. And the first value is management commitment and employee involvement, workplace hazard assessment, hazard prevention and control, and then training. And in the PowerPoint that I put up on the website after we get done today, I'll have a lot more information on those, because each one of those core values is divided up into sub elements, and those elements really give us some good ideas and drive our efforts into those 4 core values. But basically, that's what it amounts to right there, is those 4 core values of safety and health management systems, and empowering employees to make good decisions, and to also work around and get fixed unsafe conditions. So, as I said in the beginning, leadership and good leadership does not stop at the management level. It really involves everyone, and I think that's one of the things that OSHA and VOSHA tries to get across in their safe and sound activities, is that everyone has to be involved, and not everyone is going to be involved at the same level or at the same passion, but everyone has to be involved. And I think oftentimes I think about how we treat employees, and how we relate to employees, especially for supervisors and managers. And I often will say in my in-person presentations, as employees, we're all adults, and we get to make adult decisions every day in our lives. We get to vote, we get to buy things, purchase things, we get in debt, we get to get out of debt. All those day-to-day decisions are very adult decisions, and why would we not be adults when we get on the job site? And I think thinking about that and thinking of those kinds of things will really help us. I was listening to CNN on the way in this morning, and they were talking about, of course, they're talking about vaccinations. That's the topic du jour, and I don't want to get there today, but they said something that was really meaningful to me about now some employers are going to, insisting on, having employees vaccinated, or they can't work there anymore. And one of the commenters was not anti-vaccination, but said, it's really kind of about the messaging, right? So when you throw somebody an ultimatum like that, it really removes their sense of value of that organization. And I think, getting away from the vaccination, I think a lot of times we throw these ultimatums at employees. And this guy, his message in the news story was, it's all about the messaging, right? So allowing people to have choice, like, in that case there, he said one of the things that could be done is You know, if you for whatever reason can't get vaccinated, then you must get tested every week or whatever, allowing alternatives. And I think, but I think the overall message here, and again, getting away from the vaccination because I don't want this to be about that. When we're talking with employees, especially in the areas of safety and health, when we throw out ultimatums, you must do thus and so, sometimes it can tend to, you know, lead to someone thinking their value is really not there. You know, they could get a robot to do this job. So I think a lot of times we might want to think about that. Now, that's not to say that sometimes you must do thus and so. This is the way we have to do it. But I think in those cases there, communication is about training, is about reasoning. It's about allowing employees to be as adults part of that, you know, part of that process. And yeah, ultimately they have to follow the rules. But when the rules are explained and the reasons are explained, you know, a lot of times people can arrive at that decision. So just some of the things that we can do. These are not like ultra scientific. I didn't get them out of an article. These are just things that I thought about on my long ride home to and from Montpelier. Some of the things I would think about and jot down and put in some of my own experiences, both all the way up to where I am now, and certainly from where I am now, you know, having leadership responsibilities for, you know, for VOSHA employees that depend on me to provide good messaging and to provide good ability to do their jobs. So some of the things that, you know, that we as managers can do, I think being visible, I often will say there is no coincidence that management commitment and management commitment and employee involvement is the first thing on those 4 core values. And I think visible managers that avail themselves to employees, they don't become separated. You know, they're not quote unquote in their corner offices and don't give a darn about us, you know. So being visible as a manager is something that we need to really think about. And as a manager of a state program, I know how hard that is. And you know, my program is certainly not even approaching some of the complexities and commitments that other managers in private industry and even, you know, larger public sector types of departments face than I do. And I know what kind of a challenge it is for me to stay visible. So, but it's something that we really have to try hard to, you know, to maintain is our visibility and being positive. I like to say that in my department, I've worked for a dozen commissioners, and I believe that's true. Maybe it's a little more, I'm not sure, but you know, commissioners tend to come and go in our department, and I've seen them all. And I've seen commissioners come in that are tremendously positive, and you know, everybody comes in wanting to change the world, of course, but I've seen commissioners come in that are very, very positive, and you can tell they have a good time here, and they you know, they enjoy the challenge, and you know, they're always up for something. And then I've had commissioners who, you know, keep their door closed and, you know, scowls on their faces, and usually those commissioners are kind of on their way out and this is the last stop for retirement or whatever. But I think being positive and finding a positive message to your workers gets a lot done, goes a long way. So maintaining positivity is I think a really important value for managers, and holding yourself accountable, not letting yourself bend the rules, especially in highly visible activities, right? So you know, if you're a manufacturing facility and your safety rules are that when you walk out on the floor, you're dressed a certain way, wearing certain PPE, or if you're a construction company and you've got to get up and do a inspection of a certain area that requires the use of PPE, you know, hold yourself accountable to wear that PPE and to model good behavior and good decision making. Again, you know, people are looking up to us and they really rely on us to make good decisions. Being consistent. I think and consistency is a message all the way down the line. Being consistent in your message and your expectation as a manager, making sure you communicate those expectations, and making sure that you're really conscious about being consistent. And when things change, making sure that those changes are communicated and the reason for those changes are communicated. It's not uncommon for the nature of work, or for the type of work, or for the priorities of a job to change, but we really have to work hard to make sure that people understand and get that message. Being an active part of the team. These are just some suggestions that I put down. Be a member of a safety committee. Certainly making it a point to attend safety committee meetings. Help investigate incidences in your facilities. Attending an off shift safety meeting, even if it's on third shift. I think those are extra valuable. If you have a construction site, that's geographically a ways away from where your office is, take the early afternoon and head over to that site. And I'm sure a lot of you do, but head over to that site, shake a few hands, ask people how things are going, things like that. Supporting your supervisors is really, really important. They're the ones that are carrying out your message. And when we talk about supervisors, you're going to see what I think about supervisors. And your support of them is really critical, because when you walk out of that room or off that site, your employees are going to work to the ethic of their supervisors. They're not going to work to your ethic. They're going to work to the ethic of the supervisors. And if you find that damaging, I'm very sorry, but that's primarily true. And so your supervisors have to have the same message and the same ethics that you do, in order for you to make sure that they're following your message. As far as supervisors go, supervisors are the linchpin of a successful safety and health culture, and this cannot be minimized. Again, as managers, we can go out and give the message. I do a weekly staff meeting along with all of our staff, but that might be the last time that week I might talk to them. Hopefully not. Hopefully there'll be occasions where I can talk to them after. But I can guarantee you one thing: those staff members are talking to their supervisor every day. And so, fortunately, I have a ton of confidence in our supervisor that she and I are on the same page. But as managers and supervisors, you really do need to be on the same page, and they are the linchpin, because when you turn away and you focus on another project, those employees are going to work to the value system of their supervisors, and you want that to be the same value system. So supervisors should be visible, should again be accountable. Extra hard here, because as supervisors, you're there every day, you're co-working, you're doing the things that that your employees are doing, and so you really want to make sure that that you're holding yourself into just as high account as you're holding them, because the first time a supervisor violates a safety rule, there's some serious damage that has been done to the safety and health management system that you've worked so hard to try to build. Being consistent, and one thing about consistency is making sure that as a supervisor, your message mirrors that of management, making sure that's a consistent, seamless message. Staying positive with your communication. A lot of times, as supervisors, they tend to be very, very stressed, and it's easy to, especially when you're dealing with a situation where there was a failure in something, a failure in communication or whatever, it's easy to allow yourself to devolve into a place where it's not as positive. And I think it's a lot of work to stay positive, but I think it's a real, it's an effort that's really worth it. listening is a important skill, I think, for supervisors. I think being able to actively listen and consider concerns that are brought forward is a really important thing, and being responsive in a positive way. Again, being positive, but being responsive to employee concerns is in a positive way. Many times we'll get complaints from employees, and there's a questionnaire on the complaint that says, and one of the questions is, did you bring this to your supervisor? And they'll answer, yes, I did. Brought it to my management. And so, after an employee brings a complaint to management and then feels like they need to file a complaint with VOSHA, a government agency, there's probably a breakdown in messaging there that needs to be, worked on in a positive way. So listening and being responsive is a really important thing. And so just as I said, employees bear equal responsibility. And, a lot of times it's not only the new person that gets hurt. A pretty significant share of the time, we find people that get hurt or worse on the job, maybe employees that have been there for a long time. And I think, it really comes down to being able to, if you're a senior employee, being able to show the right ethic and the right value system to new employees. But make no mistake, this responsibility really comes down to everyone. Everyone bears a responsibility here. So as employees, it's really important to be knowledgeable, being knowledgeable about all aspects of the task. And then if you're not, being able to ask questions and find out the fine details of how to perform that task safely, because you can never take for granted, somebody brand new or somebody just switching jobs. They're working really hard to be knowledgeable. They may not be comfortable asking a question. So if you're a senior employee or something like that, and you see something like that, being able to just say, hey, are you okay there? Or being able to say, I used to operate this machine and just want to watch out for this, or, this is the correct way to set it up, or whatever. So, making sure that, we are knowledgeable, and if we see a coworker who's not, making sure that we address that in a positive way that makes them feel valued and could, in fact, save their life. Holding ourselves accountable, and again, especially for more senior employees, right? Modeling responsible behaviors to junior employees, gently correcting and coaching coworkers who may not be as experienced, making sure that safety concerns are being brought to the supervisor so that they can be addressed appropriately. Being a team player, holding yourself in high regard, making sure that your message is the same message, especially if you're a senior employee, making sure that your message is the same message as what's coming out of, the management and the supervisory staff, communicating with management respectfully, modeling positive behavior, just, watching out for people and being someone that can be counted on to do the right thing. If you're, if an employee is that person, then that employee will automatically be, definitely a leader. And we want to foster a culture of those kinds of people. Sometimes the right thing means that we have to shut down a job site in order to correct a serious safety violation, or shut down a piece of equipment because there's a repair that needs to be made, or a safety violation needs to be taken care of. Sometimes those are the things that we as management have to that we have to do in order to foster a really good relationship with employees. And so we finally get to a point where, you know, we might ask, what's in it for me? You know, as employees, as managers, we pretty much already know what's, you know, the benefits for us. But for employees, you know, I think they really benefit a lot from that. And in this employer environment where everybody is trying to hire everybody, I think it's really the little things that are going to allow some employers to be head and shoulders above other employers. And I think, you know, it's more than just pay. I mean, pay is one thing, pay and benefits is one thing, but I think when we, you know, offer workplaces that, you know, show employees that, you know, they're valued, and you know, the corporate value system is such that it allows employees to feel like they're being heard. You know, when you're talking about the little things, when you're talking about employees making up their mind about which job offer they want to take, sometimes it's those little things that make a big difference. And I think especially now in this really tight employee environment where everybody is just, you know, doing everything they can to beat the bushes for good help. Those employers that really can offer a good, solid, safe workplace of good culture can be those employers that can come out heads and shoulders above everybody else. You know, it's all about trust. Employees working together, watching each other's back in a positive way. Empowerment. Again, you know, from the management side, treating employees like adults, and, you know, watching, you know, our culture to make sure it's not a culture of ultimatums, but a culture of, you know, of teamwork and of team building, of consideration. And again, speaking of teamwork, you know, really having everybody on the same team. You know, I often said I was in a situation some years ago with an employee, and I was a relatively new at this job manager, and we were in a, you know, relatively heated discussion maybe. And I said to that employee, I said, you know, you don't work for me. When you come into your job, you don't work for me. I said, we work together, and we work for the people of the state of Vermont. And I think a lot of times being able to frame a discussion in that sense can really, you know, give people an idea that, hey, you know, maybe we really are part of a team here. And just, you know, managing your culture and you know, culture is one of those things that requires a constant maintenance and a constant improving. But a good, safe culture is a culture of empowerment, a culture of choices, a culture of good choices, and ultimately having a safer place to work. And one thing that we've noticed as well is those employers, this second bullet here, those employers that have really great safety culture, they tend to have employees that watch safety more closely at home. Because, you know, as good as we are at keeping employees safe, and we're very good at it, by the way, we're extremely good at it. We're not so great at keeping people safe at home. Most employees, most people, they have a much higher chance of being hurt or killed at home than they do at work. So, and a lot of times that bleeds over. That bleeds over from the workplace to home. So that's kind of the end of what I had to present. I did want to talk a little bit about Safe and Sound, but before I do that, I'd like to, if anybody has any questions or suggestions or anything like that that you'd like to bring up, you know, you can just unmute and whatever you need to do, I'd be happy to answer anything. I see someone was unmuting. No? Okay. So obviously, you know, and if you want to, you know, get in touch with me afterwards, on the state email, just dan.whipple@vermont.gov. This is the link to the OSHA Safe and Sound Week. You can get to it right from the Vermont Department of Labor VOSHA webpage. So you just go to the Vermont Department of Labor.gov and you just go right to VOSHA. And as soon as you click in, this page will come right up. So, and you can, and that'll hyperlink you right over to the Safe and Sound website with all the activities to do. Basically, it's, you know, completely voluntary, but I think it's, you know, I think it's really a neat thing to do. And in this week of raised awareness, I think it's really valuable. And a lot of times, what it comes down to is, you know, not so much the regulatory aspect of it, although that's really important. It comes down to encouraging and teaching and you know, just convincing employees and supervisors and managers to make good, sound decisions. So I'd like to open it up to Carl to talk a little bit about what we have, if there's anything related to Safe and Sound Week or what we have for later on this summer.
Hello, everybody. For those of you who don't know, I'm the new compliance assistant specialist. Are you guys getting an echo or something? I'm getting feedback.
I'm not getting one here.
Okay. The so I'm the new compliance assistant specialist. For this week, I sent out a thing with all the links to the Fed OSHA stuff to some of your groups. So if you want to spread that around to your company members, that'd be great. Or go to the link that's up on the web on this slide at the moment. In September, we're going to have a follow-on event that sort of springboards off Safe and Sound Week, and we're going to be doing a Vermont Health and Safety Week, and so on Monday, the 13th of September, we're going to have a in-person Green Mountain VPP pancake breakfast and lunch, and there we'll have some of our VPP companies presenting best practices, as well as a number of speakers for that event. We'll be sending out a registration advertisement to you guys shortly here, and that will there'll be 50 slots open to come to that in-person event. Following onto that, on Tuesday through Friday, we're going to do panel discussions on the 4 pillars of the safety system that Dan was just talking about here in his meeting, and that will be little, basically a panel discussion with questions and answers, and those will be on Teams and not in person. And that's what's coming up in September. I'm also available for any questions and anytime through at carl.hayden@vermont.gov. And with that, are there any questions?
I think we're going to be streaming that event on the 13th as well. I believe, I won't promise anything, and Kyle might be over there designing a noose to hang me off the stair rail on, but I believe that we're going to be streaming that event.
That's the plan at the moment as well.
And if you have hardware, software, or technological problems, we'll throw whatever we have to at it, Dan. It's a great thing, and we fully support what you're doing.
Appreciate that, Richard. Appreciate it. All right, I have one more slide, maybe two, to finish up what I got going on here. Hopefully, I'll be able to get it to work. Oop. Nope, I guess that's my last slide. Anyways, what I had covered up a slide that I wanted to say, but what I wanted to say is, remember way back in the beginning of the presentation, we talked about root causes, unsafe acts and unsafe conditions. And, you know, many times if we have good, empowered and educated employees, we can cut down on those unsafe acts. And if we have employees that are, you know, that are trained and knowledgeable and recognize unsafe conditions and can point those out to us, you know, we can make a difference in unsafe conditions. And when we make a difference in unsafe acts and unsafe conditions, we've made a difference in root causes, and those are the causes of the incidences that we, you know, that we can be exposed to. So that's really what it's all about. More than just finding out what the regulation is and following it. I mean, that's also important, but it really comes down to, you know, communicating at the work site, empowering employees, and correcting things that come to our attention that need to be fixed. So I thank you all very much. And on behalf of Carl and I, we'll certainly be looking for our event on the 13th, and I'll pass my mic back over to Kyle.
Hey, actually, there's a question, Dan, from Matt.
Oh, sorry.
He's got his hand
I
up.
can't see the questions here, so.
Matt, you want to unmute yourself and ask your question?
Yeah, you know, this is really informative, and definitely I like it, kind of, you know, all about decision making. One of the things that you kind of said earlier, Dan, in your presentation about the ongoing accidents that are happening out there that don't make the news, you know, those are really good opportunities for all of us as safety professionals to kind of utilize what's going on in our trainings, on our site visits. So if there's any way that we could kind of share, just kind of not the who, but more of the what happened, so we can kind of share some of that information with our organizations, you know, that would be fantastic. I don't know if that's something that we're looking to do in the state of Vermont. I utilize a little bit. OSHA does this with their fatality report, but
Right.
you know,
right.
it's very, some of it's outdated, and you know, none of it all complies. But in Vermont, I think it could be a useful tool for all of us to be able to kind of share what's going on with one another, so we can prevent some of these accidents and these unsafe conditions, unsafe acts to happen.
You know, that's actually a very interesting idea. To be honest with you, I never really gave that much thought, but I think they're, you know, they're probably, I mean, OSHA does do it, and you know, once an investigation is finished and closed, it's public information, except for, you know, that's material that's already mandatorily private just by some sort of law. But that might be something that we might think about, where we take some of these incidences, sanitize them to the point where it's really not possible to identify any particular employers, and just put them out. I mean, that's definitely something to think about. I'll be talking with Kyle about that. I appreciate your suggestion for sure.
Oh, you're welcome. Thanks for your time.
Thank you. Okay, if we don't have any more questions, I'll pass this over to Kyle. Kyle, you there?
Yes, I am. Thank you, Dan. Thank you, everybody, for joining and for the questions, and for that, both over the line and in the chat. I did throw in the links to the labor.vermont.gov VOSHA page, as well as to the Safe and Sound Week page as well. Again, just want to thank you for your attendance today. As I mentioned, this has been recorded, and we'll be putting it on our YouTube channel. I'll send the link to Carl to follow up with you all. And then you can also, Carl was mentioning about the September events, both virtual and in person. You can look for more information on that coming from VOSHA, as well as on the Department of Labor website. So with that, thank you, Dan. Thank you, Carl. And thank you, everybody, for attending, and hope you have a great rest of your day and a good week as well. So thank you.
Thank you, everyone, for taking time out of your day to attend, and good luck with Safe and Sound Week.
Thank you. I enjoyed it.
Have a good rest of your week. Bye-bye.